Welcome to Harlow on Healthcare. I'm David Harlow, and I invite you to join me by my virtual hearth as I sit down with healthcare leaders to discuss building the future of healthcare. Today, my guest is Jeremy Friese, president of Payor Markets at Olive, who is a former physician at Mayo, a former founder and leader of other healthcare technology companies, including Virata Health, a venture-backed AI tech company that pioneered frictionless prior authorization for payers and providers. He is on a mission to transform healthcare for the good of patients, providers, and payers. Welcome, Jeremy, and thank you for joining us.
David, it's great to be here. Thanks so much for having me.
My pleasure. And I should say, for the full description, Jeremy is an MD, MBA, and has been closely involved in working to improve healthcare over the years. Jeremy, I'd like to ask you to introduce us to Olive, for starters, and tell us a little bit about how you ended up at Olive.
Yeah, thank you. Fantastic to be here. Greetings, everyone. We at Olive are on a mission to create the Internet of Healthcare through the use of automation on, as we say, on both sides of the fax machine. So for both providers and payers, my friend and our founder, Sean Lane, as CEO, started the company back in 2012-13 timeframe. And since then, we've had the great fortune of having significant success, have grown the business to just raised at over a $4 billion valuation, raised about $1 billion. Most importantly, though, have 850 Olivians spread across the grid, spread across the United States, working to build, deploy automations that truly have an impact and create this Internet of Healthcare among payers and providers so that patients can get the care that they deserve, and we can unleash $1 trillion of waste in our ecosystem back into the ecosystem. We're on that mission, David, and just couldn't be more excited to wake up every day and get the opportunity to have an impact on an industry that affects so many of our lives, both personally and professionally. And I personally came to Olive after working at Mayo Clinic for nearly 18 years. I did medical school and all of my training there, and then went off to business school, as you said, in Boston, and came back and joined staff for a decade. Loved my clinical practice there, loved being an innovator in a variety of leadership roles. Became extraordinarily frustrated by the administrative hassle that even I, as a physician at arguably the best resourced healthcare system on the planet, Mayo Clinic, had to deal with, frankly, on a daily basis. And I tell the story of, I had just a fantastic team of nurses that would literally spend maybe half of their time helping me care for patients from across the world, and the other half of their time dealing with administrative hassle. And one of the primary administrative hassles that we dealt with, every Monday I would show up and I'd have a stack of manila folders on my desk that my nurses put together of prior authorizations that I had to deal with so that my patients could get the procedures that I felt that they needed. And after dealing with that as a physician and then as a physician leader, felt compelled to really try to solve this problem, not just for us at Mayo, but across the ecosystem. And so left Mayo to start the business that you described, Virata Health, to connect providers and payers and automate this hugely cumbersome problem of prior authorization. And we're fortunate to do that with really a team of remarkable technologists and healthcare leaders, including the gentleman that invented much of what we all know of as Google Maps satellite. And so really, really understood how to build AI at scale that can truly have an impact on societies. And that's what we were fortunate to be able to really get off the ground and prove that we could do for providers and payers at Virata. And we were acquired last year by Olive. And so now have the great pleasure of serving as the president of our Payor Market and really taking the mission that we were on at Verada and putting it on steroids now at Olive. And so just really, really fortunate to go through that journey and to be where we are today and truly feel like we're really having a significant impact. So appreciate the time together today, David.
So you said a couple of things I want to dig a little bit deeper on. One is being deployed at a number of healthcare institutions around the country. I want to understand what it means when you say Olive or Olive's AI is deployed. And I also want to dig a little deeper into AI. We say AI a lot, and I don't know what it means. I'll be honest. I hear a lot of phrases that describe aspects of AI or types of AI. And I wonder if you could dig a little bit deeper. So first, sort of maybe describe when we say Olive is an AI as a service, what does that really mean? And when you say it's deployed, what does that really mean?
Yeah, great questions. Thanks for the clarification. So we view this problem as truly an enterprise-wide problem for both providers and payers. And both sides of the fax machine have an enormous number of people doing administrative things, pushing paper, really working as human routers, pushing paper, pushing information electronically from one place to another. And by our estimation, that equates to $1 trillion of waste and billions of hours wasted by humans. So we have our technologies deployed across 46 states across the United States. And when we go into a partner, a customer, we sit down together at the executive level and at other levels to say, what are the primary problems that you're having? And how can we deploy Olive to help solve those manual problems? And so those problems, I'll just speak on the provider side to start, can range from truly back office administrative problems like revenue cycle management. How do you get paid? How do you get bills out the door? How do you understand claim status? To operating room efficiency and supply chain management and other aspects like that. And so that, when we talk about our technology, we describe Olive showing up every day, 24/7, so that she can do that work and never takes vacation. And again, it's across problems across the healthcare ecosystem. When we talk about our AI as a service, David, that's what we're talking about, deploying Olive to solve the problem that our customers identify jointly with us as their biggest problems.
Right. So as I understand it, there's sort of different aspects or different types of tools, if you will, that might be better suited for different types of problems, right? So maybe there's a robotic process automation for back office work that needs doing. Maybe there's deep learning going on around, I'm just throwing this out there, image recognition, assistive service around reading a scan, reading an X-ray. Is that right? What is Olive and sort of what's the opportunity for AI in healthcare?
When we describe Olive, we have 5 what we call strategic maneuvers or platforms that we deploy with different skill sets. And so we have the first is Olive Works. That's our AI worker that works 365, 24/7. And that sort of falls in line with what you described as robotic process automation and the ability to continually do these processes that are repeatable and the same thing over and over again. We also have Olive Helps. Olive Helps is our lightweight desktop attendant. That's the AI assistant to the humans that are doing work. And so we know in healthcare, and as a physician, I firmly believe healthcare is a human endeavor, and humans will always be front and center. Olive Help's job is to surface information when it's needed most, based on what that human is doing at that time. And so imagine starting to work a prior authorization and Olive Helps shows up on your desktop and tells you what the medical necessity rules are for that particular patient, for that particular plan that they have in Massachusetts or Idaho or wherever they happen to be, instead of having to go find it. The next platform is Olive Shares. Think of that as the fiber of connectivity among providers and payers. And so there's all kinds of information, both billing, claims, prior authorization, information that's flowing through the ecosystem. That's Olive Shares that helps automate those processes. The next is what we call Olive Assures. This is our payment platform that uses our other maneuvers as well as the ability to pay claims at the point of care instead of having armies of humans on both providers and payers that need to evaluate all of these bills and claims. And then lastly is Olive Knows. Olive Knows is our search capability, healthcare only. So think Google for healthcare, based on the massive database that we have been able to accumulate. That's both clinical and non-clinical. So imagine asking Olive whether, for example, is a prior authorization needed for this member, or what's the most common knee implant used in Florida? And so it's an ability to query that database. And so it's a combination, David, to get to your initial question of what is artificial intelligence. It's a combination of all of these automation technologies where the computer is able to act and do work as if it were a human at its most basic level.
Okay. So you talk about training this AI against a tremendous amount of data that's in the system, so to speak, or that's passed through the system. And you've described earlier healthcare institution partners that you're working with. I guess the question is it enough data? Is it ever enough? Does the intelligence get smarter being exposed to more data? Or is it an iterative process, recursive learning against the same data? Where are you on that journey?
Yeah, that's a fantastic question that anybody in the space sort of grapples with constantly. We have about a petabyte of data today, and one of the things that we've felt really strongly about, and the way we architected the system, long before I was at Olive, is the recognition that there's great power in connecting the automations that we have across our ecosystem. And so as we have one AI worker in California working that, we take that data and put it in our, what we call Deep Purple, our single brain that connects our automations across an enterprise and across the ecosystem across the United States. And so it's by having that mentality from the beginning that we've been able to amass this petabyte of data growing at 3 terabytes per day so that we can continue to refine and improve the algorithms that we have, but also identify new areas of opportunity that we as humans may not even see. And so that we call the flywheel of Olive being able to identify opportunities because of what she is learning across the ecosystem. And so the data scientists among us would all say, we need more data, and that's true, but we've certainly reached a scale that we have a massive data set that we can do really interesting things with across an enterprise. And again, that's both clinical and non-clinical, which makes this so powerful.
If you're just tuning in, this is Harlow on Healthcare, coming to you on Healthcare Now Radio. I'm David Harlow, and my guest today is Jeremy Friese, president of Payor Markets at Olive. Jeremy, I love the naming conventions and the way you speak about Olive. It humanizes healthcare, it humanizes the technology. The next thing that I wanted to ask you about is really sort of the flip side of that, really. When we're looking at AI from a regulatory perspective, as in recent days and weeks, as we're speaking, governments and international agencies have been doing. We've heard about AI from the EU. We've heard about AI from the WHO. We've heard about AI from the FDA. And how do we need to think about AI in healthcare? These agencies have a concern about ethics, about the ability to evaluate what AI is doing, about accountability, transparency, and things like inclusiveness or equity. I wonder how you think about this. How does the company think about this?
Yeah, I very much appreciate the question, David, because this is something that we as a company and as a leadership team talk a lot about, and as a physician, I care deeply about. As I alluded to before, healthcare is and will always be a human endeavor. And there are things that technology can and should be a part of, and there are pieces that frankly need to be done by a human because of practical reasons, but also as you've alluded to, because of ethical reasons. And so our focus today is very much on the administrative side of healthcare, and in part because that's where the initial big opportunity is for us in healthcare, but also because of this question of ethics and what can and should computers be able to do for something that is in many ways the most personal aspect of our lives, our health. And so could not wholeheartedly more support the work and the conversations that are going on at government, at FDA, and beyond. And so, we're very eager to be a part of those conversations and really help steer and make sure that we as a technology company and as a patient care advocate really make sure that this is done well. And there's much that we need to do both from government and technology and providers and payers coming together to really ensure that this is done thoughtfully and done well, especially as, for better or worse, oftentimes for worse, I think, we healthcare are behind in terms of technologies being deployed that are deployed across other industries.
Right.
And so what we're seeing with other large technology companies, especially in the social media space, grappling with some of these things, we get the opportunity to really define that upfront before it's widespread and deployed. So that, I think I'm excited to be able to harness that opportunity to be able to do that thoughtfully and to do it well with our counterparts.
As you think about the future, I wonder if you can contemplate the past year or so that we've lived through with the pandemic, and wonder if you have something to share about the experience of the company through this or the field more broadly. What has the pandemic shown us in terms of needs for AI in healthcare, in terms of opportunities for AI in healthcare? What do we know now that we didn't know before last February, March?
Oh, that's a great question. And boy, have we learned a lot as a society and as a healthcare ecosystem over the last year and a half. We've learned that you can have meaningful time with your grandparents over Zoom. And we've learned that you can have meaningful conversations with your healthcare providers through telehealth. We've learned that you can work anywhere in the country and not only be productive, but in many ways even be more productive. And we've learned that same thing as providers and as payers in the healthcare ecosystem, that people can be anywhere and be productive and be effective. And we've learned that we can and need to work in a different way to really be able to deliver the same value that we have in the past in healthcare. And so what we've specifically seen when it comes to automation is a really significant increase in both not only just the willingness to evaluate it, but it really went from kind of interesting innovators doing it to either conversations or deployments across the country, big, small, medium-sized providers and payers, and a real recognition that we can't do things the same way we did 2 years ago, in part because of financial stress that happened throughout the ecosystem, but then also, just recognition that our people can't work in the same way that they have in the past. And so they need AI to do some of the work for them, or they need an AI worker to help them do the work more efficiently. And so I think it's been a pretty profound year and a half in just the education of all of us on, frankly, what can be done and what we can do together.
Yeah. As you're speaking, it occurs to me that maybe AI may be put to work in thinking about how how to help rationalize the system and how to rationalize sites of care, for example, inpatient versus outpatient, facility versus non-facility. We've moved so much care to virtual. The concern, of course, is that with the quote-unquote emergency being over, everything snaps back to what happened before. I don't think it'll ever snap back all the way, but it seemed there are signs of things snapping back pretty far already. I wonder what your thoughts may be about, is that something to guard against? Is that part of the waste that you talk about? Is this an opportunity? Have you seen lowering of waste in the interim, or is it sort of too soon to tell?
I would agree that we are seeing some, reversion to the way care was done pre-pandemic. And that's, I think, completely understandable, expected, and appropriate. And, as a physician, there are times when you just have to lay your hands on someone's abdomen to really, really be able to make a diagnosis and provide the right care. So we need to bring some of that care back. But I think we've to the beginning part of your comment, David, we've seen how you can provide care in different ways and in different locations and through different, through maximal use of the providers that you have. And so being able to use technology to make sure that the right patient gets the right care at the right time by the right provider is absolutely something that technology can and should and will play an increasing role in. I mean, I'll tell you as a proceduralist, it's not a good use of the patient's time or anyone's resources for me to see, a patient that doesn't need or have a high likelihood of needing a procedure so that I can truly help that individual. If they had a medical problem, they should really be seen by someone that, is going to be able to help them with their problem. And we're seeing interesting technologies and companies start to work on that particular problem, just as you described. So not only site of care, but site of making sure that providers are practicing at their highest level. And those are the kind of patients that are being seen. And I think that's only going to accelerate, David.
That's both encouraging and depressing to hear you say that we're working to provide services to the right patient at the right time in the right setting with the right provider, because we've been saying that for decades. But I guess that's why we have the waste issue that you've described. Well, Jeremy, to wrap things up, I'm going to ask you my final question, which is, if you were to wake up tomorrow and find yourself 5 years in the future, what's one thing in healthcare that you would hope or expect to find has changed drastically?
5 years from now, I see a world where people are doing the work that they are maximally trained to do and not spending time on the things that they shouldn't. Patients are getting the care that they deserve in a faster, more efficient manner than they do today. That costs are being driven out from these wasteful activities and being put into research and development, that we're actually able to bend the cost curve of how much is being spent on healthcare by using technology in a way that makes sense. And the decisions are being made by providers, by physicians, by nurses, by other providers that are maximally trained to provide this care across our wonderful country.
Well, it's a hopeful vision for the future. And on a lighter note, I'll ask you, would you spend some of that savings on a nice bicycle? That's what I would do.
I would love to use it on a nice bicycle.
Okay. Well, maybe when we get there, we'll go for a nice ride on the road somewhere together. Thank you for joining me, Jeremy. I appreciate it.
Thank you very much, David. Greetings all.
You have been listening to Harlow on Healthcare. Join us at healthcarenowradio.com. Let's continue the conversation on building the future of healthcare together at #HarlowOnHC. I'm David Harlow, keeping the fire going and holding a seat open for you. Until next time.